Luca Ferasin. I'm a cardiologist and I work at Lumley Park Veterinary Specialist in Hampshire.
And earlier today you talked to a packed auditorium on the big things over the last 10 years in cardio. Did that go down well?
I hope so, yeah. I think that people enjoyed it, but obviously I'm not the best judge, so you need to ask people who attended it.
So could you just outline the main learnings from that for us, please?
Well, it was a very difficult topic to lecture because in the last 10 years there have been so many studies published about the management and diagnosis of heart disease. So I had to select some studies that I consider important for the advancement of cardiology. And I mentioned some of the very important studies like the EPIC study, which is about the treatment of dogs in the preclinical phase of mitral valve disease. And obviously the result of the study changed the way we treat mitral valve disease in dogs. I mentioned the more practical advice for people in practice, like the use of the sleeping respiratory rate for monitoring the response to treatment. I mentioned the importance of the loudness of heart murmur to understand the severity of the underlying disease. I mentioned the association between coughing and heart disease. And then obviously in an hour it was pretty difficult to cover all the novelties of the last 10 years.
And that's the last 10 years, but what do you think is going to be driving developments in this area over the next decade?
Well, I think there are some studies still in progress, some that just finished. So we got drugs like spironolactone, for example, or the combination spironolactone with benazepril that may have an effect in the preclinical phase. So it will be a study similar to the EPIC, but using different drugs. So we got big hope about this study. We've done, I mentioned briefly the studies in cats, but we don't have much available at the moment. I'm sure there will be a lot of studies that can be performed for the diagnosis and treatment of heart disease in feline medicine.
And I mean that's medicines, but I mean will genetics figure in that at all moving forward in cardiology, do you think?
Well, again, genetic tests can be helpful, but I don't think they can substitute, at least with the information we got available, all the clinical information and the diagnostic tests. So it can be used in association with other tests, but alone they can have at the moment some potential risks of misinterpretation. So I'm obviously very open to genetic tests, but they need to be interpreted very carefully.
So exciting times ahead in that field.
Oh, absolutely, absolutely.
And obviously One Health is a big deal at the moment. You've got a lovely story that illustrates that nicely. Can you share that with us?
Oh well, the story is the story of my son Mattia. He was diagnosed still in uterus with congenital cardiac disease, multiple. And when he was born, obviously he was severely affected, had to go for open heart surgery, only 6 days of age. Everything went okay, so it was a beautiful outcome despite the anxiety and apprehension around these 7.5 hours of surgery that he went through. And the interesting outcome also involves another story which ran parallel to this, which was the story of the dog of the surgeon who did surgery on Mattia. And this dog was affected by cardiac disease, so I managed to diagnose the defects in this dog and manage the condition accordingly. So we found very interesting that vets and human doctors were working on the same level and sharing the same level of apprehension and sympathy for our relative patients.
And both doing great now?
They're both doing very well, even the dog, yes, absolutely.
And what are you going to be doing the rest of the time at the show? Obviously, we're getting towards the last knockings on the Thursday.
I will spend the rest of the day going around meeting friends. This is a fantastic opportunity to reconnect with old colleagues and visit the stands, because there's a lot of material there to see.
And as we mentioned earlier, there's a bit of negativity in some circles around the profession sometimes, but could you tell us what's good, what's great about being a vet?
Being a vet is, doing the job we always dreamed about. We all wanted to be vets since a very young age, so being able to do it is a privilege. So I think that's a big positivity of being a vet. And obviously the negative facts is a very hard profession. and it's tiring, it's emotionally draining. So we need to be just aware of this and train to cope with these emotions in order to survive the bad times. But otherwise, I would say the glass is always half full.
Fantastic.
Yes.
Thanks, Luca. That's brilliant. Thank you.